Bismillahirrahmanirrahim. I am Hifza Zahid from DPT first year, Shalamar School of Allied Health Sciences. The topic of my presentation is macular edema. What is macular edema? Macular edema is the buildup of fluid in the outer plexiform and inner nuclear layer of retina. The retina is the paper-thin tissue that lines the back of the eye, containing photoreceptors, rods, and cones. And in the center of retina, macula is present. The accumulation of fluid in this part of retina is called macular edema. Now, what is the etiology of macular edema means, what are its causes and how it happens? So first of all, the main cause is the damage to the blood vessels, which eventually results in leakage of the fluid and its accumulation in retina. Then how these vessels are get damaged? These vessels can get damaged in various forms. As we know, in diabetic patients there is excess in sugar level which increase the oxidative stress. Due to this, there is an increased reactive oxygen species and it will damage vessels. In some persons, occlusion of central retinal vein occurs, which means blood supply to retina close partially or completely. Due to this, hypoxia occurs and it will damage blood vessels. The person who has macular edema, his retina is not able to produce sharp image. His vision is blurred or wavy. Along with it, color vision defects also occurs. He sees fade colors. Sometimes macular edema is not significant. Clinically insignificant macular edema does not show visual symptoms. From the center of macula, the 500 micrometer draw a circle. Is retinal thickening occurs within this 500 micrometer, this is the clinically significant macular edema. If exudates are present within 500 micrometers, this is called significant macular edema. If thickening of retina is also out of 500 micrometers, this is also significant macular edema. Most common cause of visual impairment in diabetic patient type 2 is this. In diabetic macular edema, sugar level in blood increases, blood vessels constricted and oxygen supply reduces, so blood vessels goes in oxidative stress. They release free radicals like hydrogen peroxide. Due to this release, the blood vessels damage and results in leakage of fluid. This fluid is accumulated and edema occurs. Initially, it is located in between outer plexiform and inner nuclear layers, but later it also involves the inner plexiform and nerve fiber layers. Sometimes, after few weeks of surgery, especially cataract surgery, people may develop macular edema, but this is not long-lasting or severe. It is mild and short-lasting. Eye drops are used to treat inflammation. In this disease, there is breakdown of macula. In some cases, like wet age-related macular degeneration, new and abnormal blood vessels grow from the choroid. They leak fluid into the macula and causes macular edema. Sometimes blockage occurs in retinal veins. Blood does not drain properly and leaks into retina. Due to this, macular edema occurs. In this figure, you can see the plaque formed in the vessels, which result in the blockage for the blood flow. Due to this, blood leaks into the macula and macular edema occurs. Out of 10 layers of retina, fluid accumulates between outer plexiform layer and inner nuclear layers of retina. It accumulates in the macular region and gives cystoid-like appearance, so it is called cystoid macular edema. Now, what are things which can cause macular edema? If surgery is done after few weeks, cystoid macular edema occurs. Retinal vascular disease, mean blockage of any vessel, can also cause cystoid macular edema. If any inflammation occurs in retina, this can also cause accumulation of fluid, results in cystoid macular edema. Along with it, drugs and retinal dystrophies also cause cystoid macular edema. The person who has cystoid macular edema has blurred and distort vision. Sometimes the image of objects are perceived to be smaller than they are actually, which is micropsia. The signs of cystoid macular edema are loss of foveal depression, thickening of retina, optic disc swelling, lamellar hole visible, blurring and distortion. In this video, you can see the fluid leak from the vessels and accumulate, forming cystoid-like appearance called cystoid macular edema. How these different types of macular edema are treated? These can be treated by laser photocoagulation, intravitreal anti-VEGF agents, intravitreal triamcinolone. Laser photocoagulation, focal. It is a method of laser photocoagulation to treat microaneurysm that occurs in macular edema in the retina. For this purpose, the diode or argon burns of sufficient power is applied to get grayish reaction. Grid. It is another method to treat macular edema. In this, burns are applied on macula to reduce its thickening. The sufficient power is used to get mild reaction. Intravitreal anti-VEGF agents. Many intravitreal anti-VEGF inhibitors play important role in treatment of diabetic maculopathy. Intravitreal triamcinolone. In some intravitreal triamcinolone steroid injections are used to reduce retinal thickening, but if they are using in pseudophakic eyes, there is a great risk of increase in intraocular pressure.